Thank you. Governor, First Lady, Lieutenant Governor, members of the Cabinet, and Justices of the Supreme Court, thank you for joining us here today as we open our legislative session. It is an honor to stand here, not just at the start of a new session, but at the beginning of a new decade, a decade which is vastly different than that our leaders faced at the start of the last. As lawmakers came together to open the session in 2010, they did so in the throes of the Great Recession. The financial and housing markets had collapsed, and unemployment was reaching crippling levels. State leaders all across the country were faced with the difficult task of choosing a way forward. States like Florida that made the difficult budget and regulatory decisions enjoyed a full recovery, and many, like Florida, enjoy an economy that is better and stronger than the one we had before the recession. Those states that chose to tax and spend their way out are still looking for answers, and some of them now have the additional problem of dealing with the mass exoduses from their states. Members, spending isn't caring. Solving is caring. As we begin this new decade, we must keep that ever present in our minds. The decisions that we make here have far-reaching consequences, but not just for the residents of Florida. Florida is a national leader in innovative policy and in fiscal restraint. With the work we do here is regularly cited by other states and often adopted. If the states are the laboratories of democracy, Florida is a leader in bipartisan, effective, and functional government. Last year alone, we passed transformational healthcare and education policy, which is already being discussed in legislatures around the country. One such legislation stands out as an example of what is possible when we all work together. Frustrated by the unrelenting abuse of the pharmaceutical companies, we chose to fight rather than to simply pay their ransom. With the leadership of our governor and with our partners in the Senate, we looked past our state line and even beyond our country's borders, and we passed the first in the nation drug importation bill. Since the conclusion of session, our governor has worked tirelessly with the president to force action. Against all odds, the FDA was forced to act. Few issues have attracted the mass special interest opposition our drug importation bill attracted. Big Pharma hired every firm in town, it seemed, and they flooded the airwaves with false claims aimed at frightening our citizens. But still, we did not flinch. It is true, we still have a long road ahead in achieving full importation, but we moved an immovable object. And we did something far more significant. We proved that when we all come together, government of the people still lives. So as we turn our attention forward, we still face many challenges. And unfortunately, chief among them continues to be healthcare. We did not choose healthcare as our priority. It's been daunting to challenge its many facets. It chose us. It chose us through the sheer audacity of the defenders of the status quo. I'm not given to hyperbole, and I use these words with precision. The healthcare industrial complex, made up of hospitals, medical device manufacturers, and pharmaceutical companies, are the great robber barons of our time. The term robber baron is defined by government manipulation, monopolizing of an industry, and price gouging. Check, check, and check. The caregivers who work in these institutions are good and dedicated people, and we're fortunate to have them. But the collective actions of the institutions that employ them are unconscionable. These institutions interact with our citizens at their most powerless and exposed moments, and they financially assault them. If during a hurricane, a supermarket, or a hardware store, or a gas station raised its prices even slightly, there would be mass outrage, and rightfully so. But if, God forbid, on your way home today, something terrible befalls you and you're involved in an accident, You will be in the hands of very good people that will work hard to save your lives, and the institutions they work for will gouge you for every good and service that is provided to you. Simple things like bags of IVs, needles, and gauzes will be charged to you at sometimes hundreds their original cost. And should you fail to pay, you will find yourself among the millions of Americans who have made bankruptcy as a result of exorbitant medical bills. This is unquestionably the greatest threat to our solvency. And what do they propose as a solution? More funds, of course. More money leads to higher prices, which leads to more money, and so on. What is truly amazing to me is that their appetite is so insatiable that they would risk their own existence in the pursuit of more. The drumbeats of socialized medicine grow louder each day, but so attracted is this industry to their gravy train that they fall deaf to its warning. Politically, they now seem to have the advantage. Our citizens demand from us reforms which we propose and the healthcare complex opposes. What we are left with is only spending as proof of our concern. Well, spending is not caring. Solving is caring. If spending was the answer, we would have already solved the problem, as we turn over nearly half of our entire budget to them. This industry gets federal dollars, state dollars, local dollars, and we also extend them any manner of local tax breaks. And it is not enough. It will never be enough. We must do as we did last year and have the courage to empower the patient and loosen the regulations which have allowed their empire building, or it will never be enough until there's nothing more to give. Each day they find new and different ways to attract patients and public dollars. The newest iteration are the standalone emergency rooms. These facilities are primary care substitutes at emergency room prices. They are highly profitable because they can charge significantly higher rates for regular services. How do I know this? I have actually had hospital executives boast of their standalone ERs and the effects that they have on the bottom line. The audacity is such that they advertise them openly on billboards listing the wait times. Clearly, this isn't intended for anyone in an actual emergency, as I can't imagine one would have time to shop. This is done to lure us into their facilities for far less emergent conditions. Moms and dads take their children there for sore throats and earaches and fevers. But if we're being honest, we share a good measure of the blame. We often allow and even provide the conditions necessary for this abuse. One very notable example of negligence on our part has been a great limiter of access. You see, fewer and fewer medical students are studying to be primary care physicians these days. The cost of schooling is very high, and the specialties offer them a far more lucrative future. This, together with our exploding population here in Florida, has created a large and growing demand for primary care, which will soon reach crisis levels. Florida's archaic and backwards approach to scope of practice has contributed to this problem. Florida is one of a handful of states that still prevent healthcare professionals from practicing what they are educated, trained, and certified to do. In spite of truly overwhelming evidence, Florida resists. This kind of protectionism on behalf of special interest groups is not just costly and dangerous, but it is wrong. In 1967, a report was provided to then President Johnson, which explained that more Americans had died that year in accidents than had died in the entire Korean War. The main problem was lack of critical on-site care. You see, at the time, ambulance drivers were just expected to throw you onto a gurney and rush you to the nearest hospital. And people were dying in droves along the way. A few courageous and visionary doctors in California, Pennsylvania, and right here in Florida argued that training the ambulance attendants to administer on-site care would drastically reduce fatalities. Needless to say, the physician community at large was outraged. The idea that a non-doctor would provide care to an accident victim on the side of the road in the chaos of an accident scene was preposterous. Fortunately for all of us, these visionaries weren't deterred. They pressed forward, and the millions upon millions of lives that have been saved since then are their greatest legacy. How telling of the power of an interest group that I stand here today, over a half a century later, trying to convince lawmakers not to allow people with a 2-year degree and 400 hours of training to administer care on a blood-stained pavement in a chaotic setting. No, I am standing here saying that an advanced nurse practitioner who has at least a 4-year degree in nursing, a graduate degree, in many cases, as in the case of our nurse today, that is a doctorate in nursing, and 2,000 hours of clinical supervised residency to be allowed to practice what they studied. Allowing advanced nurse practitioners to practice independently will have immediate positive effects on access and affordability. Members, it is truly a stain upon a state that prides itself on leading to even humor talk of patient safety coming from interest groups, when we know now, beyond a shadow of a doubt, of its safety and of its efficacy. Or worse, to use phrases like, if you want to be a doctor, study to be a doctor. Members, 30 states have outgrown this backwards policy. 30. It is high time we allow healthcare professionals to practice to the extent of their training. Another area where proliferation spending threatens its own sustainability is our higher education system. We all proudly boast of having the best public university system, but as Tom Sowell often likes to ask, compared to what? Compared to a system that would be sustainable and that would not put our children in debt at the very beginning of our lives? I don't think that that's what we compare it to, because there doesn't seem to be a system that offers that across the country. Our shared desire to see everyone reach the highest level of education they can achieve has allowed for excesses and created a student debt crisis. Colleges seek to be universities when they would far better serve us in their original roles as colleges. Universities seek extravagances in the ways of buildings and sports programs which adversely affect their cost, and private colleges seek all takers. As lawmakers and custodians of the public purse, we are relentlessly urged for more. An expenditure for a university is seen as a measure of caring, regardless of the future implications of that expenditure. Spending is not caring. Solving is caring. Our focus must be ensuring these institutions will have the sustainability to exist in perpetuity. Public universities and colleges need to be leading the way in finding efficient and sustainable higher education. Our scholarship program is also a crucial component. You know, Chairman Fine is far more given to hyperbole than I am. But he has done excellent work in this area. These scholarships are important for access, but simply pouring more money into them doesn't in any way provide a guarantee that the right people will receive them. With the work that Chairman Fine has done, we will look very closely at these programs to ensure that their requirements and, most importantly, their outcomes are in line with the mission. Then there are those areas where more resources are in order. Our governor has made the environment a major priority, and we will continue to offer our support in his efforts. He has also tasked us with finding ways to increase teacher pay. This House pledges to work towards a significant but equitable and sustainable proposal that can accommodate wage increases in other critical areas as well. One area in particular will be that of our child care workers. New leadership brings us the opportunity for transformational change. Our budget will include wage increases for child protective investigators and their supervisors, as well as additional dollars for their support staff. These fine folks work day in and day out in some of those stressful situations, and they make decisions that are crucial to children's safety and to parents' rights. We must support their efforts and provide them the tools needed to succeed. But understanding that spending alone is not caring, solving is caring, we are embarking on an ambitious collaborative effort of reform. Together with our partners in the Senate, with the Governor and Secretary Popple, and with the tireless advocacy of our First Lady, we will begin the work of reshaping child welfare in Florida. That includes updating infrastructure and reorganizing workflow, but it also includes gathering data and using it to achieve the best outcomes for the unfortunate families who find themselves in these situations. It means being the best that we can be at deciding whether to separate a family or to help them remain together. To these ends, we have partnered with Florida State University, and with the commitment of President Thrasher, we will become national leaders in gathering, studying, and developing best practices for our child welfare system. We thank you, President Thrasher. We will fully fund the Florida Institute for Child Welfare at FSU so that they can develop and constantly advance their curriculum at the FSU School of Social Work. But as excited as we are about these efforts, we know that not all solutions are governmental. And that is why we will work with organizations like Better Together to ensure that avoidable family separations and the tremendous bureaucracy that comes with family reunification can be minimized when justifiable. And finally, the issue we all like to say is our only constitutional obligation. Chairman Cummings and his sub-chairs have worked diligently on a reprioritization project in all budget silos. The result of their work will allow us to meet new spending requests with existing dollars. I thank you, Chairman, and I thank all of your sub-chairs for their effort. I look forward to working together with all of the members of this House to once again pass a budget with a reduced per capita spending, a robust tax break, and a stronger commitment to our reserve balances. I hope this decade does not bring the kind of economic turmoil that the last one did. But our actions today will determine how quickly our state and our leaders will be able to stabilize and recover tomorrow. Leader McGee, I look very much forward to working with you and your caucus and to building on the great work that we did last year. To President Galvano and the Senate, we reaffirm our commitment to work as we did last session, collaboratively and in the interest of all. And Governor, we look very much forward to your leadership as we enter this new decade. Thank you all very much. And members, to all of you, I thank you for the trust and the confidence that you have placed in me. I reaffirm my commitment to you to conduct the business of this House with decorum, with integrity, and with equal respect for all. May God bless all of you. May He bless the great state of Florida, and may He bless America. Thank you.